Contact 7 is committed to helping Coloradans get back on their feet as the governor prepares to lift our state's stay-at-home order in just 3 days. That is why we've launched the Rebound Colorado initiative.
But there is a delicate balance between the health of our economy and the health of our community. Megan Lopez with our Contact 7 Rebound team takes that issue 360 tonight.
It's a mantra we've heard time and again over the past couple months. Stay home, stay healthy, stay alive. As the COVID-19 pandemic spread, first cities, then entire states started issuing stay-at-home orders. On the health side, hundreds of thousands are sick and tens of thousands in the U.S. have died. An otherwise healthy economy is also suffering. The stock market went into a tailspin and tens of millions have filed for unemployment. With so many Americans out of work, is there a point where states will have to completely reopen their economies regardless of the health implications? In this 360, you'll hear from health experts, an economist, a business professor, and the president of the Colorado Libertarian Party about lifting the stay-at-home orders. Across the country, states are trying to strike a balance between public health.
We want to give every Coloradan a fighting chance.
And the price of a pandemic.
We're looking at the data every day to get the economy open as soon as is possible.
President Trump hoped to get back to a sense of normal by Easter, but that day came and went, and the deadline was pushed back.
The plans to reopen the country are close to being finalized.
States have also delayed reopening, waiting for a sign that it's safe. Others have faced criticism for moving too quickly.
Things are very urgent. I don't want to in any way let people think that we are out of the woods.
For doctors and nurses, people are the priority.
Social distancing is the single most important thing that you can do for the state of Colorado.
Even if stay-at-home orders are hurting the economy.
Once you start pulling back, there will be infections.
Dr. Anthony Fauci has cautioned against reopening completely until we can figure out how to contain the spread.
What you do if you jump the gun and go into a situation where you have a big spike, you're going to set yourself back. We have to have something in place that is efficient and that we can rely on, and we're not there yet.
Because you can't put a price on a life.
God bless America.
On the nearly silent streets of Denver, the calls to reopen can be heard loud and clear.
This order, I think, is wrong completely.
Victoria Reynolds is the chair of the Colorado Libertarian Party.
We believe that the virus is very real. We also believe that the effect to the economy could be very, very real.
She says while the virus is sickening thousands, millions are suffering financially.
I see people who are unable to eat because they can't buy food. They have no income coming in.
Reynolds doesn't believe the governor should have the authority to close the economy. She wants people to make up their own minds.
We don't need a handout from the federal government. What we need is to be allowed to work.
We do need to consider how we're going to reopen the economy.
There's a moral dilemma to bringing back business too quickly. Across the country,
most Americans are as concerned about the economic side of the virus.
While the virus is killing thousands, financial hardship also has a dark history.
The folks who were unemployed during the Great Recession, about 10,000 suicides were linked to the financial distress, anxiety, and depression.
DU professor Andrew Schnackenberg recently surveyed 400 people about the balance between public health and the economy and found older Americans were more likely to put an emphasis on public health. Younger adults took a more balanced approach. Interestingly, those who've contracted COVID-19 or whose loved one did,
they were more worried about the economy, far more worried about the economy than folks who had not contracted COVID-19.
Ultimately, though, the choices of today will affect the future of public health and the economy.
We very well could be looking at another Great Recession based on the decisions we make today. That
we've never had this kind of steep drop-off so quickly.
So what could our recovery look like? Experts look at 3 models, V, U, and L-shaped. Just as they look, V is a quick downturn followed by a quick recovery. Goldman Sachs predicts this pandemic could look like that.
People are describing this they started describing this as a V. I think that's a misnomer.
A U-shape is a bit longer of a revival, and an L is the worst-case scenario with a long, drawn-out recovery. For economist Richard Wabakin,
I'm thinking more like a U that you would draw that would look like this.
Because he says the underlying economy is healthy.
Going into this, we had some of the strongest economic data that we've seen at the federal level, and really this recession it's disease-induced, but it's government-induced. I mean, the government decided to shut the economy down.
He's been impressed with the federal and state actions being taken, but
there is a point where, it's callous, and economists talk about these things all the time. What's the value of a life? You get to a point where at some point you've got to say, putting the economy into unbelievable tailspin for a long period of time is just too detrimental.
So the way he sees it, the economy must reopen sooner than later, regardless of the coronavirus. Ready or not, testing or not, Colorado is getting ready to reopen parts of its economy with a new Safer at Home initiative. But it will not be business as usual. Companies will still face limitations. There will still be financial strains, and we will all need to take new precautions. If not, we risk going from open to closed once again. Megan Lopez, Denver 7.